Well, hello, good evening, everybody. Thank you for joining. My name is Dr. Alex Millman, and I am the Chief Medical Officer of the Georgia Department of Public Health. I wanted to thank you for taking the time out of your busy schedules to be able to join us for tonight's educational webinar on promoting COVID-19 vaccination. We have two other excellent presenters who are with us tonight. They will be introducing themselves very shortly. But I wanted to just thank you for attending, and we look forward to having an educational session tonight to be able to provide you with updates on COVID-19 vaccination, to discuss a little bit more about how to discuss COVID-19 vaccination with your patients, as well as to let you know about some additional activities that we have planned related to promoting COVID-19 vaccination. So thank you again for joining us. So as stated, our objectives for today's webinar will be to assess the safety and effectiveness of the COVID-19 vaccine in women who are considering pregnancy or are pregnant, to understand the importance of having conversations with patients about getting the COVID-19 vaccine, and to also identify next steps you can take in your role as a provider. So I'd like to just turn this over to our Commissioner, Kathleen Toomey, for a message.
Hello, I'm Dr. Kathleen Toomey, Commissioner of the Georgia Department of Public Health. I want to begin by thanking each of you for providing critical patient care during this unprecedented time of COVID. While we've been focused on COVID, life goes on. Women get pregnant, babies are born, and healthy, loving families are created. That is welcome news. But we must continue to diligently educate women about the seriousness of COVID to them and their unborn children, and reassure them about the safety of the COVID vaccination. Vaccination is safe and effective for women who are pregnant, breastfeeding, trying to get pregnant now, or might become pregnant in the future. Data suggests that the benefits of receiving a COVID-19 vaccine outweigh any known or potential risk of vaccination during pregnancy. Vaccination is the road out of this pandemic for all of us. Thank you again for all you are doing, and please do not hesitate to contact DPH if you have questions or we can be of help to you.
All right. Well, thank you. So again, my name is Dr. Alexander Millman. I'm the Chief Medical Officer of the Georgia Department of Public Health. So I want to just present the most important message up front about COVID-19 vaccination and pregnancy, which is the American College of Obstetricians and Gynecologists, the Society for Maternal Fetal Medicine, and the CDC all recommend that pregnant and lactating women, as well as those who are trying to get pregnant now or in the future, be vaccinated against COVID-19. So just to give some information about COVID-19 vaccines and pregnancies, and some of our other speakers will go into more detail about some of these, pregnancy increases the risk for severe illness and death from COVID-19. COVID-19 is associated with adverse maternal, pregnancy, and neonatal outcomes. Data on the safety of receiving mRNA COVID-19 vaccine during pregnancy are reassuring. The receipt of COVID-19 during pregnancy reduces the risk of infection. Vaccination during pregnancy results in maternal antibodies that have been detected in infant cord blood. And one very important thing, and this is where your role as a provider is critical, vaccination coverage for pregnant people is low. So just to provide a quick overview of what's happening with COVID-19 in Georgia, these two figures show the number of confirmed PCR positive cases on the left and the number of confirmed deaths on the right. And as you can see, Georgia has experienced multiple waves. The current wave that we're in right now on the far right of each of the figures shows that the number of COVID cases that we've had as a result of the Delta variant has been some of the highest that we've seen, rivaling the wave that we saw last winter. And this is both in terms of the number of cases that we've seen, as well as in terms of the number of confirmed deaths that we have seen. But if we look at national data on COVID-19 and pregnancy, we can also see that COVID-19 has infected almost 125,000 pregnant women over the course of the epidemic. And we can see that it's been something that was seen particularly badly during the last winter epidemic, but we've seen another rise in cases among pregnant women during the most recent Delta wave during the summer months. But one story that's very important about COVID-19 and pregnancy is that it's not just cases among pregnant women. Pregnant women who are infected with COVID-19 also end up getting severely ill and need to go to the ICU. And we also see deaths among pregnant women who are infected with COVID-19. And as you can see, what we've been seeing in the during the Delta wave in the summer months, which is indicated in the red box, is we've seen a large number of pregnant women who have been unfortunately requiring ICU admission, as well as a large number of deaths among pregnant women, higher than what it had been during previous reporting periods. And just to bring this into additional perspective, there have been studies that have been done that have been looking at severe illness and adverse maternal pregnancy and neonatal outcomes among pregnant women who have been infected with COVID-19. So we can see that pregnant women compared with non-pregnant women of reproductive age with COVID-19 have a 2 to 2.5 times odds of ICU admission, invasive ventilation, as well as requiring ECMO. And if we look at pregnant women infected with COVID-19 compared to pregnant women without COVID-19, we also see increased risk of certain adverse pregnancy outcomes, such as increased risk of maternal death, preeclampsia, preterm birth, stillbirth, as well as higher risk of NICU admission for the infant. And to just put this into perspective as well, this is just illustrating the same. If we look at severe illness and death for symptomatic pregnant women with COVID-19 compared to symptomatic non-pregnant women, we can see adjusted risk ratios that are considerably higher among pregnant women with COVID-19 for ICU admission, mechanical ventilation, ECMO, and death. Similarly, COVID-19 infection, we also see perinatal infection among neonates born to pregnant women with SARS-CoV-2 infection. This study is illustrating results of that, in which we found that about of 136 or 4% of those tested were PCR positive, and nearly all of those were born to mothers with infection close to delivery, and there was a positivity that was higher among those born preterm. This is one study from Israel that shows the cumulative incidence of SARS-CoV-2 in vaccinated versus matched unvaccinated pregnant women. And as you can see in this particular slide of about 7,530 vaccinated and 7,530 unvaccinated pregnant people, you can see that those who are vaccinated have a significantly lower risk of infection compared to those who were unvaccinated. And this slide, also from a study from Israel on a different patient population, shows similar results among women who were pregnant compared to those who were unvaccinated. In which case, we can see that the blue line there shows the cumulative incidence among people who were vaccinated. The red line shows the cumulative incidence of people who were unvaccinated, and you can see a clear separation that's occurring after people were fully vaccinated, in which the cumulative incidence among vaccinated continues to be significantly lower than that among people who were unvaccinated. So just some overview on COVID-19 vaccines. There are currently 3 vaccines that are authorized for use in the United States for those aged 12 plus. Just last week, CDC has provided additional recommendations for people who received Pfizer as their primary series, in which booster shots are now available for those who are 65 years and older and residents in long-term care facilities, those who are aged 50 to 64 with certain underlying medical conditions, those who are aged 18 to 49 who are at high risk for severe COVID due to certain underlying medical conditions, as well as those 18 to 64 who are at increased risk for COVID-19 exposure and transmission because of occupational or institutional risk factors. And ACOG does support pregnant women being eligible for booster dose as being categorized as having an underlying condition. So I'd now like to turn it over to my colleague, Dr. Woodham.
Thank you so much, Dr. Millman. I'm Champa Woodham. I'm the director for maternal fetal medicine at Atrium Health Navicine in Macon, Georgia. And I also am a faculty member at the Mercer University School of Medicine. I first want to touch base on a few things that we have briefly talked about, but I want to go into some further detail for you all. In regards to safety of COVID-19 vaccine in pregnant women, there are several points that I think are very important for us as providers to know so that we can educate our patients. One of the questions we frequently get asked is the vaccine going to give the infection to me or to my baby? And the answer is no. It has been shown that the vaccine does not cause any type of infection in the pregnant woman or their baby. And the side effects from the vaccine are in fact just a sign that the immune system is actually working as a result of the vaccine. And another point I want to make is that even after getting the first dose of the vaccine, only 5 days afterwards, one can start seeing an antibody response in the patient that received the vaccine. And then when we talk about pregnant patients, the question we get is how quickly can those antibodies transfer over to the baby? And it's been shown to be as soon as 16 days after the first dose. And then another question we get is, what about antibodies in cord blood or in terms of breast milk? And in fact, they have been shown to be present in both. What's important, just kind of going back to one of the studies that was just covered by Dr. Millman, the Israel study that showed, in fact, getting the vaccine did allow patients to have a lower risk of infection than those matched same age group that were not vaccinated. And I think what's also important to know is this is an ongoing effort. As of September 7th, more than 150,000 women have already taken part in V-Safe. And I'm going to cover that in a few slides to talk about what that is and how we can encourage our patients to also participate so we can obtain more data. Another question I get is, what about spontaneous AB risk? Is that higher after getting the vaccine? And multiple studies have showed that it is not. So the baseline risk in our general population that we counsel our patients on is a risk of about 11 to 22% of having an SAB when someone is pregnant. And if you look at the table on the slide, you can see that the range of SAB goes anywhere between 1.7% risk to 14.1% risk. And again, that is very similar to the general population, whether you get vaccinated or not. What's really important also to talk about with our patients is the risk of infection in our pregnant folks. So what happens? What kind of risks go up? And the three particular risks that I like to highlight are the risk of stillbirth. It's twice as higher in a patient that has a COVID-19 infection during their pregnancy. The chance of the baby going to the NICU is over 3.5 times the risk, and almost 5 times the risk for the mom to end up in the ICU as well as a result of the infection. So going back to the V-Safe registry, V-Safe is a smartphone-based tool. And what it does is it sends text messages and surveys to a patient once they register. And it has what's called health check-ins at certain points after vaccination, both after the first dose as well as the second dose. One of the questions that's asked when someone signs up for V-Safe is, are you pregnant? or are you considering pregnancy? And if the answer is yes, those participants then go into the pregnancy registry branch of the V-Safe registry. And then those patients are followed. This slide shows at what points in the pregnancy a patient will be contacted once they've registered. And as you can see, they get a phone call in each trimester of pregnancy. They also get one about 4 to 8 weeks after the delivery, and then again one after their baby is over 3 months of age. This particular table shows a comparison of some of the previously published data in regards to outcomes that I think a lot of our patients ask us about: risk of miscarriage, risk of stillbirth, premature birth, having a baby with growth restriction, birth defects, as well as neonatal death. And as you can see from this table, the risk from previously published studies prior to COVID-19, those numbers are very similar to those that we have seen so far from the folks that have registered in V-Safe that have gotten the COVID-19 vaccine and were pregnant at the time. This snapshot is the handout that we should be giving to our patients after they get the vaccine. The actual screenshot on the left shows the QR code. All they have to do is take a picture of that QR code and it links them directly to the V-Safe registry. I did it myself when I got the vaccine. It's super, super easy. And as soon as they do that, they start getting the questionnaires on their phones. So we've talked a little bit about the VAERS, that's the Vaccine Adverse Event Reporting System, and this is all connected. V-Safe and VAERS talk to each other, as well as the CDC. And what happens is that when a patient receives the text messages or questions on their phone, if they were to respond saying that there is a suspected adverse event, whether it's related to the vaccine or not, it goes to the VAERS, and then that group contacts the patient directly with questions pertaining to the reported symptom. And in terms of who can contact VAERS, it could be the patient, it could be a family member, a health provider. So you can either go through the V-Safe registry, or there's a way, and you'll see in a future slide, there's a way to contact VAERS directly to report these types of symptoms. There's two categories. There's the type of symptoms that in regards to healthcare providers that we're required by law to report. And there's actually a list on the VAERS website of those certain side effects that we must report. And then there's a list by the actual vaccine manufacturers of certain contraindications for which a person should not receive any other doses. So those are the ones that we must call in to actually report. And then there's others that we encourage healthcare providers to also report. If there's any kind of symptom where there's even slight question, is it related to the vaccine or is it not? It doesn't matter. That's up to VAERS to further investigate. So if there's any question whatsoever, it's wise to go ahead and make the call or go online and submit any concerns. And here on this slide, this shows you both the way online through VAERS that you can file a report with any concerns, as well as their email and their phone call line. Now I'm going to hand the mic over to Dr. Shermer to take over the presentation. Thank you.
Thank you, Dr. Woodham. And my name is Austin Shermer. I'm a reproductive endocrinologist on faculty at Emory, and we can advance the slide. So getting a COVID vaccination is of paramount concern to fertility patients. These are people who have spent a long, long time trying to conceive, and anything that might have the most subtle of effects on their chance of conceiving, either with fertility treatment or spontaneously, is something that they might well avoid, even if they would otherwise absolutely be prone to getting vaccinated. And so one of the challenges has been addressing their concerns in a way that is satisfactory to them. It satisfies their concern that there might be something that happens to their fertility after they get vaccinated. And so when we look at the data, and we didn't have great data until recently. We all in our field strongly recommended it. American Society of Reproductive Medicine, in addition to ACOG and SMFM, recommended it. But when we actually started to get data, we verified what I think we all knew based on some of the early information we were getting to be true, which is that there is no evidence that getting vaccinated for COVID-19 causes a loss of fertility in women or in men. And so we can move to the next slide in a second, but I wanted to address male fertility first, because this is a very common concern. I think that there is a particular focus in terms of misinformation or just inaccurate information online about this. This was actually studied fairly recently. There was a research letter that was released in JAMA in June of 2021, Gonzalez et al. It was from Miami, where they did a prospective study and looked at semen parameters in young men. The average age was 28 years old, prior to and after they received the COVID vaccination. And there was no statistical difference in semen parameters before or after vaccination. So I finally have information I can give to my patients that has looked at this in a way that I think is much better taken up by our patient population. If we move on to the next slide. One of the things we struggled with was, how do we convince our female patients that this is safe? And I think the data about safety in pregnancy came before data about safety from a fertility standpoint. But fairly recently, Morris et al. Published a study in, actually it was just Morris, excuse me, not Morris et al., in fertility and sterility, in which in his clinic, he obtained serum samples from patients who were undergoing an embryo transfer and tested it to see if it was seropositive for antibodies against the COVID spike protein. And in this study, patients who were found to be reactive, who were seropositive, had basically were given a questionnaire to ask whether they had any exposure to the COVID itself and whether they had an infection, and whether they'd been vaccinated. And when they compared these groups after an embryo transfer was performed, there was no difference in the chance of implantation as determined by beta HCG and then sustained implantation when they monitored beta HCG levels in patients who were had never been infected, who'd been infected with COVID, and who'd been vaccinated. This provided the earliest, I think, possible reassuring data, hard data, that we can present to our patients that the COVID vaccine is safe prior to undergoing fertility treatment in patients who are trying to become pregnant and in patients who are actively undergoing treatment.
Right. Thank you so much to our guest presenters. Next, I just want to discuss COVID-19, how to discuss COVID-19 vaccines with patients and how to address issues related to vaccine hesitancy. So, as healthcare providers, you are a trusted source of information for your patients. Making a recommendation for a patient to get vaccinated with COVID-19 is one of the most important steps that you can take as a provider in terms of being able to get patients vaccinated. But one thing that's important to note, as Dr. Woodham and Dr. Shermer had mentioned, is that their patients do have concerns about COVID-19 vaccines. And just some of the surveys that we have done, this is not necessarily specific to a pregnant population. These are just concerns in general that patients have. Many of the concerns that patients do express when they're considering the vaccination are things related to long-term side effects, concern about not enough testing. Some people are concerned about short-term effects. And then, as was mentioned, patients who are pregnant or thinking of becoming pregnant may have specific concerns related to that. So, having some of these discussions with people who are vaccine hesitant, There are some strategies that one can try to do in having some of these conversations that are not always easy to have, especially if people have certain types of misinformation that they're coming into the visit with. It's important to be able to figure out how you want to discuss that type of situation with the patient so that it doesn't become an area of conflict, and instead it becomes an area where concerns can be addressed, and then you're able to try to have an appropriate approach with shared decision making for the patient, with the hopeful goal of being able to get them vaccinated. So in terms of dealing with patients who are vaccine hesitant, some strategies that have been shown to be able to work are just, first off, starting by leading with listening. Try to understand what the patient's point of view is, even if the patient has beliefs that may have been influenced by misinformation. Just being able to understand where they actually are is very important for being able to continue that discussion. Some of the other options that are available too involve using patient-centered communication techniques, such as asking open-ended questions, being able to ask about permission to share information for COVID-19 patients, trying to meet the patient where that patient actually is. If the person is in a pre-contemplative state and they say, I'm under no circumstances am I going to talk about COVID-19 vaccine, that's a very different type of patient, obviously, than one who's saying, you know, it's like, I'm a little concerned about getting the vaccine, and here are some of the things that I'm worried about. Can we talk about this? Other things that are important to do as well, as with other patient encounters that are even non-related to COVID-19 vaccine, just being able to provide accurate answers using clear and simple language. It's also important too that even though there are data to be able to support COVID-19 vaccines, there is still some uncertainty that's out there. There are areas related to COVID-19 vaccines that we don't know about, and it's important to be able to acknowledge the areas that we know as well as the areas that we don't know. It's also important too to be able to provide data-driven information on the risk and the impact of infection for pregnant women, as Dr. Shermer and Dr. Woodham have just provided some information on. And then the most important thing, if the patient is, if one of the most important things for being able to influence patient behavior is for you as a provider to give your strong recommendation for the vaccination. So what are some next steps for you as providers? So if you are interested in becoming a COVID-19 vaccine provider, the Department of Public Health is going to be holding a series of enrollment webinars so that we can provide information on how you would be able to enroll to become a vaccine provider. So there will be more information that will be shared about that after this event. And we do hope that if you are interested in becoming a vaccine provider, that you do attend so that you would be able to enroll. If you're already a vaccine provider, thank you for participating as a vaccine provider. We also have information that's available online as well as print resources that can be shared with patients in terms of being able to give them information on how they can book their vaccine appointments. And one piece of updated information that I would like to also be able to share that could be of interest to you as providers is that there is a recent change that has happened with Georgia Medicaid. So as of July 1st, 2021, Medicaid providers can actually seek reimbursement for counseling their Medicaid patients on the importance of COVID-19 vaccination. So for billing purposes, the procedure code for this is 99401 as preventive medicine counseling, and the reimbursement rate for this is $28.29. And there's more information that's available about this on the Georgia Medicaid website. But I did want to just highlight this as it is new, and it is something that can be used for counseling that you do for COVID-19 vaccination for your Medicaid patients. So I know there's a lot of information that's been shared. I would love to be able to open this up for questions.
Thanks, Dr. Millman. This is Megan Andrews. I'll be hosting the Q&A portion of the webinar. I did make an announcement during the webinar, there's a chat function. If you have questions, please feel free to drop them into the chat and I can have one of our experts here answer them for you. We don't have any at the moment, so I'll give it another minute or two for anyone that's in attendance. Please feel free to ask your questions in that chat function.
We're just waiting a minute to see if we're going to get any questions.
All right, I have not received any questions in the chat, but if anyone does have follow-up questions, the contact information for our presenters are on the screen, and I'm sure they would all be happy to answer any follow-up questions you may have. And with that, I'll turn it over to Dr. Millman to close out.
Sure. Well, I wanted to thank you all for joining tonight. I think we're hoping that I thought that this was a really, really great presentation, and I really want to thank Dr. Woodham and Dr. Shermer for being able to join and to share their expertise. I also wanted to thank our participants as well for joining tonight and taking time out of your day to be able to learn a little bit more about COVID-19 vaccination and pregnancy, as well as to encourage you, if you are interested in becoming a vaccine provider, to consider joining one of our enrollment webinars. You know, there's a lot, our situation with COVID-19 vaccination. You know, we are continuing to make a lot of efforts to be able to vaccinate our patients. However, there's still a lot more work that needs to be done. There's still more unvaccinated individuals than we want, and especially for the population of pregnant women or people who are thinking of becoming pregnant, we really look to you as providers to be able to have these conversations with your patients and to be able to make a recommendation for COVID-19 vaccinations with your patients. We know that you're very busy with the work that you're doing, and we thank you so much for taking the time out of your day to be able to join this. And I want to just thank you on behalf of the Department of Public Health, as well as to wish you good luck in the conversations that you have with your patients for recommending COVID-19 vaccination to them. Thank you.